Hi, I'm James Bowers, along with Katherine Kent and Jennifer Thomas. We're going to present to you how we can prevent diabetes, diabetic care and lifestyle changes, and complications of diabetes. To begin our presentation, we've made a diabetes brochure. This just includes very small, say, tidbits of what our presentation's going to present, and real quickly we'll just kind of cover those and we'll go into more in depth throughout our video. So on the left hand side you can see it talks about the importance of checking your blood pressure regularly, making sure you're within the normal parameters set and where the doctors want you to be. It's important to see an eye doctor regularly if you have diabetes or if you're worried about complications from the diabetes or preventing it. This is a very good indicator. In the middle there we talk about the symptoms of hypoglycemia, which include shakiness, dizziness, sweating, hunger, headache, pale skin color, sudden moodiness or changes in attitudes, clumsy or jerky movement, seizures, difficulty paying attention or confusion, also tingling sensations around the mouth. And throughout the presentation as well, we'll go into more of these complications, which can cause damage to eyes, kidneys, heart, blood vessels, and nerves. And part 2 of the brochure, next page, it focuses a little more on the importance of preventing diabetes, also where we're going to go on and teach. One of the biggest things we can do to prevent is what we eat. It's important to always, make sure we have all the veggies, fruits, balance, moderation in all things that we eat. It's in the middle, enjoy what you're eating, but eat less. You don't want to be gaining extra weight, being overweight, or an increased BMI. And then also, when we're going to cover in the PowerPoint, it is so important to be active, stay active, and exercise. If you have diabetes, always check your blood sugar and be on top of that. This is just a very small example of the things we're going to talk about further into the presentation. Hope you enjoy. The American Diabetes Association confirms that in the United States, over 20 million people live with diabetes. 6 million of these people do not know that they have it. It's estimated that 54 million people in the United States have pre-diabetes. 1.4 million Americans are diagnosed with diabetes each year. The total cost for the care of diabetics last year was $245 billion. Diabetes versus pre-diabetes. Diabetes is when you have a higher than average blood sugar or glucose levels in blood or urine, which can either be caused by low levels of insulin production or by the pancreas not working effectively. Prediabetes is a term given to people who have blood sugars or blood glucose values between normal and diabetic levels. Diabetes cannot be cured, but prediabetes can be reversed. Because of this, prevention is essential and an important aspect, because people with diabetes are significantly higher risk of having poor cardiovascular health and developing diabetes later on. The Center for Disease Control and Prevention has found and done research that moderate weight loss and exercise can prevent or delay type 2 diabetes among adults who are high risk. The important aspect here is identifying those who are at high risk. Some of the risk factors are over the age of 56, race or ethnic background, American Indians, African Americans, Mexican Americans, Native Americans are those that are at high risk. Family history of diabetes, being overweight, or having a larger than average body mass for your body size, or BMI, low physical activity level, high blood pressure, or history of diabetes or gestational diabetes. The key to these is prevention, prevention, prevention. Some of the things that the American Diabetes Association urges people to do is look for opportunities to move during the day. Something as easy as, instead of taking the elevators or the escalators, take the stairs. Look for time that you can just spend walking instead of taking the easy route. Exercise 30 minutes at least 5 times per week. Eat a healthy meal including grains, cereals, fresh fruit, vegetables, low-fat dairy, and lean meat. Reduce your fat intake. Maintain an ideal body weight. On this page there's a couple statistics that were very interesting. Every 2.2 pounds of weight loss reduces the risk of diabetes by 13%. 58% of new cases of type 2 diabetes can be prevented through programs such as the YMCA's Diabetes Prevention Program. If you haven't heard of that, it's a group through the YMCA. They help people eat healthier, increase physical activity, and basically a support group to, if they do not have diabetes yet, to prevent that. On the bottom right, little diagram down there, 6 diabetes prevention tips: exercise, eating right, shed weight. Also on this one, no smoking, not drinking alcohol, which are also factors that can cause or increase risk for diabetes, and if needed, get support. This is a video here. It's Meet Chuck, a diabetic dog. You can click on the link or go to YouTube. It's a wonderful, fun video that just highlights the importance of diabetes, and it's a great watch.
Hi, this is Katherine Kent, and I will be going over diabetic care and lifestyle, because you matter. The signs and symptoms are not as apparent at first for prediabetes or type 2 diabetes, but can come on quickly for type 1 diabetes. So diabetes, know the symptoms and know the signs. On the left, you can see a list of signs and symptoms such as blurred vision, extreme hunger, fatigue, frequent infections in the gums, skin, or even vaginal infections, increased thirst, irritability increased, ketone presence in urine, slow healing sores, unexplained weight loss, urination frequency increased. So for diagnosing diabetes, Healthy People 2020 has 18 of its goals related to diabetes. And for the diagnosing, they will take random blood tests to test blood sugar levels, meaning a level of 200 milligrams deciliter or greater suggests diabetes. Fasting overnight blood sugar test, less than 100 is normal. A level between 100 and 125 milligrams a deciliter is prediabetes, and greater than 126 on 2 tests means someone's a diabetic. Oral glucose tolerant test, overnight fasting with periodic testing. Over 200 milligrams a deciliter is diabetic, and 140 to 199 is pre-diabetic. A1C to see blood sugar control over past 3 months. An A1C level below 5.7 is normal, and between 5.7 to 6.4 indicates pre-diabetes. Make your doctor aware if you have any of the listed signs and symptoms. Monitoring blood sugar and ketone levels. To monitor the blood glucose levels, you'll want to wash your hands thoroughly and use a lancet. Prick your clean finger, place blood, and insert a testing strip. Read your blood sugar results, and then take the insulin or diabetic medications prescribed by your doctor. For ketone levels, obtain urine sample in a clean sample cup. Place test strip in urine and record lower ketone levels. Ketones result when fat is broken down for energy when insulin is not used in the body. Having blood glucose level checks is a secondary prevention to prevent or treat early signs and symptoms of diabetes. Medication compliance. In the United States, 1 in 12 to 13 adults have diabetes, and it is turning into an epidemic. Depending on the type of diabetes you have, you may be taking insulin, diabetic pills, or both. There are a variety of insulins and diabetic pills. Some of the insulins can be short-acting, intermediate-acting, or long-acting. Some of the diabetic pills could be named glyburide, Janumet, metformin, Novolin, and more. You want to know the what, the when, the how, and the why. What are you taking? When should you take it? How is it to be administered? And why am I taking this insulin? What is it for? And what blood sugar level should my blood be at before I take it or not? Remember to check your blood sugar. Keep a record of blood sugar levels taken as prescribed by your doctor. Know the side effects of your diabetic medication. Have a healthcare provider show you how to do your insulin shot if this is your first time. Know what signs and symptoms to look for with low blood sugar or high blood sugar levels. Know the signs and symptoms of low and high blood sugar levels and be prepared with either sugar, glucose, insulin, diabetic pills, because knowledge saves lives. With hypoglycemia, that is low blood sugar, and some of the signs and symptoms could be headaches, sweatiness, shakiness, grumpy, dizzy, confused, or hungry. Cold and clammy, need some candy. With hyperglycemia, that is high blood sugar level in the blood. You could be thirsty, may want to throw up, blurry eyesight, dizzy, headaches, tiredness, weakness, cramps. And sometimes they'll say high and dry, sugar high. So be prepared to know what signs and symptoms your diabetes is showing. Don't let diabetes stop you from living a happy and healthy life. Ask your doctor for information on your type of diabetes and medication management. Get information on what foods to eat for carbohydrate and sugar level control. Follow an exercise plan prescribed by your doctor. Learn to eat healthy and delicious tasting meals. Stop diabetes through the American Diabetes Association. If you want to take a look at this link below from the American Diabetes Association, it will show you how to monitor, control, and live a healthy lifestyle with diabetes. It is very user-friendly. You can do a right-click on this link and open it up, and it will teach you more about
diabetes in the older adult. I want to talk about stopping the complications that are related to diabetes. This is Jennifer Thomas. Diabetes shortens life expectancy by about 7 to 8 years in people age 50 and older. Diabetes also drains the U.S. economy of about $174 billion a year. So, diabetes is the 7th leading cause of death. Diabetes is a leading cause of kidney failure, lower limb amputations, adult onset diabetes. There are more than 29 million Americans with diabetes. Effective treatment can prevent or delay the complications of diabetes. Nutrition is important with diabetes. Knowing your blood sugar, eating healthy foods go together. You should always eat in moderation. Overindulging in sugary foods or overeating is really dangerous. Avoid all-you-can-eat restaurants. This has encouraged you to indulge or overeat. Eat fresh foods. Eat at your usual time or as close to it as you can. Bring a healthy dish if you're going to a party. If you have a sweet treat, cut back on the carbs on your regular meal, but don't skip meals. If you slip up, get right back on it. Don't avoid desserts completely, but maybe do a 3-bite rule, or just have a taste, or just have desserts occasionally. Obesity can be another complication. Exercise can help with this. Join a class. Do exercise with others. Check your blood sugar before you exercise, and if you exercise for more than an hour, recheck it. You may need to bring a snack. Exercise is valuable because it burns extra body fat, it strengthens muscles and bones, it lowers your blood cholesterol pressure, it cuts your bad cholesterol, raises your good cholesterol, and improves your blood flow. It boosts your energy and mood and tames your stress. So all this can also help with the obesity. Uncontrolled diabetes damages your major organs in your body. It can cause heart attacks, kidney failure, vision loss, peripheral artery disease, leg amputations, and nerve damage. Diabetes is a leading cause of morbidity and mortality. You need to get your diabetes in control to prevent all these complications. Diabetes can also cause complications that can lead to amputations. Warning signs: you may feel pain or cramping in your feet, tingling, burning. You may not be able to feel hot or cold temperatures. You may have blisters, sores, ulcers, infected corns, or ingrown toenails. You need to see your podiatrist or your foot doctor right away. Don't wait till the sore gets out of control. Always wear comfortable shoes that fit right, that don't pinch or rub. Wear socks. Don't go barefoot outside. These are all ways to help prevent amputations and protect your feet. Next, I want to talk about your eyes. You want to make sure you're getting a yearly eye exam. You want to save your vision at whatever level your vision is, because diabetes can cause diabetic retinopathy. It can lead to cataracts or glaucoma, which could lead to blindness. Falls are really common with older adults and those with vision impairment. So you want to take care of your eyes so you don't lose your vision and you're able to stay in your home. This next slide has a really good link that'll explain this in more depth. Lastly, 68% of people 65 and older with diabetes die from some form of heart disease, and 16% die from strokes. Diabetes can affect major organs in your body, which can lead to an array of serious complications when left untreated. You want to make sure you're taking care of yourself and following the healthy lifestyle. Healthy People 2020 has goals related to diabetes and these issues. D 2.2, reduce the rate of cardiovascular disease deaths with persons with diagnosed diabetes. D7, diabetes whose blood pressure is under control. Having your blood sugar and your blood pressure and your cholesterol under control can help prevent this common complications. We appreciate you watching these videos. We'd like you to please comment on those and leave us some feedback. We appreciate this. This is Jennifer Thomas, James Brower, and Katherine Kent signing out. Thank you. We hope to hear from you.